Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today, we are joined by County Executive Armin Budish, Board of Health Commissioner Terry Allen, and Board of Health Director of Epidemiology, Surveillance, and Informatics, Jana Rush. We will begin by hearing from our county leaders, and then we'll have some time at the end for some questions. So with that, I will turn it over to Executive Budish. Thank you.
Thank you. This Sunday is Mother's Day, so happy Mother's Day to all the mothers who are watching. And to anyone still thinking about what to give mom for Mother's Day, how about a vaccine? A vaccine for her, her children, her grandchildren, and other family members. The pandemic is still raging. People are still getting sick and dying. So we still have to protect ourselves by wearing masks, sanitizing, and social distancing. The best protection is a vaccine. When you get vaccinated, your life can begin to go back to normal. You can take the grandkids to visit mom in person instead of just by FaceTime or Zoom. So the question is, have you gotten your vaccine yet? Just over 45% of Cuyahoga County residents have gotten their first shot. And that's not too bad. We're about 8th in the state and the best of the large Ohio counties. But we can do better. The trend isn't so great. On March 31st, 13,000 residents received a vaccine that day. This week, we're under 1,500 a day, which is not too good. There's plenty of vaccines, so that shouldn't be a hurdle any longer, and logistics shouldn't be a major problem either. You can call United Way of Greater Cleveland's 211 line to register or visit the state site, which is on the screen. And you can see it there. Transportation is available. If you have a group of 20 or more, you can get a ride to the mass vaccination site at the Wolstein Center through our partnership with RTA. Just call 216-615-6313. Again, that number's on your screen. Walk-in appointments are also available now at practically any vaccination site. You don't have to register. You can generally walk in and get a shot, including at the Wolstein Center. Our vaccination efforts so far have shown us what is possible. We just had the NFL draft in town, and the world saw a glimpse of what Cleveland and our region can be when we return to normal. So this week, don't forget mom. Give her the best gift possible, vaccines for your entire family. Now, even though we're still knee-deep in the pandemic, we're still helping the community move forward on other fronts. I previously talked about our efforts to fight climate change and improve the health of our residents by planting trees. We recently announced grants around the county to plant another 4,000 trees through our Healthy Tree Canopy program. Combine this with our first round of funding and we'll already have planted over 5,400 trees. Our funding this year will allow for 20 tree planting projects, 5 tree planning and planting projects, and 1 new county tree nursery at Stearns Farm in Parma. Projects that align with our equity and vulnerability goals were given special consideration so that they can continue to reduce the effects of climate change in their communities. Municipalities are dedicated to increasing their canopy coverage because they know that it'll improve the health and well-being of their residents. Thank you to Mike Foley and our Department of Sustainability and to the County Planning Commission for their work on our tree program. One more announcement for today. You may have seen in the news that a court recently disallowed the CDC's moratorium on evictions. While that decision is certain to be appealed, it points out the problem facing millions of renters around the country who are facing eviction because they've fallen behind in their rent payments. We don't want people thrown out of their homes. So I'm asking County Council to add another $10 million to our rent relief program, bringing the total to about $30 million. That means the county is helping about 8,000 renters remain in their homes and avoid eviction. If you've lost income due to the pandemic, you can apply to receive up to 12 months of assistance to help ensure your housing stability. Funds are administered by CHN Housing, and if you are in need of assistance, you can apply at neorenthelp.org. Again, the site is on your screen, neorenthelp.org. The potential for a wave of mass evictions is a looming disaster. We know there's a need for this in the community, and we're working to meet that need and keep residents in their home. One final item. Yesterday, Mayor Frank Jackson announced he will not run for re-election. I sincerely want to thank Mayor Jackson for his long-time, passionate service and his steady leadership. His is a very tough, stressful job. Everything he did was for the people of Cleveland, not for himself. The only way the region moves forward is through collaboration. Under Mayor Jackson's leadership, the city and county have collaborated on many important projects. I'm thankful to have another 6 months to work with him. We still have a lot to do. And I look forward to continuing and building on these collaborative efforts with whoever succeeds Mayor Jackson. Thank you. And with that, I'll turn over the program now to Health Commissioner Allen.
Thank you, Executive Budish, for your continued support of public health and the work of all of our staff throughout the pandemic. I know on multiple occasions you've taken the time to acknowledge the long hours and extraordinary commitment that our staff have made to protect the community, and we are very grateful for your leadership. Today, I'm happy to report that we continue to see improvements in our trajectory for COVID cases and vaccinations. As Armin noted, about 45% of our residents, over 460,000 folks here in Cuyahoga County, have started vaccinations. And the case numbers also continue to trend down. We do remain at 216 cases per 100,000 on the Ohio Public Health Advisory System, which is down from about 260 cases per 100,000 from the previous time we met. Our testing positivity rates also continue to drop incrementally, and we'll hear from Director Rush a bit about our trends there. We know that many local libraries are now distributing free rapid home test kits for COVID-19 testing. The kits are easy to use tests, and they detect the virus when people are most infectious. The at-home tests are made possible through the library's partnership with the Ohio Department of Health. And you should contact your local library if you have questions or would like to access one of these free tests. So this is all positive news, and our steadfast commitments to masking and distancing and other protective measures are clearly working, continue to work, in conjunction with increasing vaccination rates. As Executive Budish noted, our rate of increase has slowed, and so we have to continue to work hard to encourage our friends and family members to get vaccinated. And vaccine that was once scarce is now available in over 136 locations all over the county, often just around the corner. Pharmacies, hospitals, community health centers, Wolstein Center, the Cuyahoga County Board of Health, and the Cleveland Department of Public Health are all offering vaccines, and many places are offering walk-in appointments. It's now easier than ever to get that shot, and we encourage everyone who can get vaccinated to take advantage of the easy access to this life-saving vaccine. On the schools front, we continue to work with the Educational Services Center and other partners in vaccinating employees and students in the school environment. As we await the final approval from the federal government to extend the Pfizer emergency use agreement to allow vaccination for 12 to 15-year-olds, we are talking with community partners like the Educational Service Center, hospitals and community health centers about a range of options for families to get their children vaccinated. So there'll be more to come on that in the coming days. There are a wide range of vaccination sites in the community that already offer Pfizer, and they can be contacted for vaccinating this group once this approval is given. And as Executive Budish mentioned, you can contact 211, who is always available for assistance. Going forward, we at the health department here will continue to offer a wide range of vaccination opportunities throughout the community. In the near term, we have clinics planned for the following locations, and these locations are available on our website at ccbh.net. Today, we're out at Cleveland Heights Recreation Center providing Pfizer vaccine from 10 to 4 p.m., and we are taking walk-ins. We'll be here at clinic. We'll be here at the Board of Health on Monday, May 10th. We'll be giving Moderna vaccine from 9:30 to noon and from 1 to 3:30. We'll then go to May 11th at Word Church in Warrensville Heights. It'll be a Pfizer clinic from 10 to 2. And we'll repeat again a Moderna clinic at Warrensville Heights on May 12th from 10 to 2. On Friday, May 14th, we'll be at East Cleveland Salvation Army, and we'll provide Moderna vaccine at that location. And then Saturday, May 15th, we'll be at the Islamic Center of Cleveland to deliver Pfizer vaccine. So lots of places to go and many sites available. As the executive notes, it's not hard to get vaccine now. It's widely available, it's convenient, and if you've been waiting for that convenience, it's here now, and we encourage you to take advantage of it. Just a reminder to everyone that Ohio State Federal Mass Vaccination Clinic in downtown Cleveland is offering the Johnson & Johnson vaccine next week. And anyone 18 years or older may receive the single-dose Johnson & Johnson vaccine from Tuesday, May 11th through Monday, May 17th. The clinic located on Cleveland State's campus at the Wolstein Center accepts walk-ins from 8 a.m. to 7 p.m. And appointments can also be made and booked online at the Get the Shot coronavirus.ohio.gov website or by calling 833-4-ASK-ODH. That's 833-4-ASK-ODH. The clinic will continue offering first doses of the Pfizer vaccine to anyone age 16 or older through May 10th. Second doses of the Pfizer vaccine will be administered beginning Tuesday, May 18th for those who receive their first doses of vaccine at the Wolstein Center in late April and early May. So recently, I was at one of our vaccination clinics and a man came up to me and told me that he wasn't sure that he wanted to get the vaccine. I asked him why he'd come, and he said he was doing it for his mother. And that seemed like a pretty good reason to me. In fact, that's one of the big reasons why I chose to get vaccinated, for my father and for my mother. With Mother's Day just around the corner, as Armin noted, what better gift to give your mom than to get vaccinated against the virus, to protect her and all your loved ones. It'll be the gift that keeps on giving. And finally, and I think most importantly, if more people get vaccinated, we can save at least 100,000 lives of Americans who would otherwise die from COVID-19. And what could be more important than that? So at this point, I ask you or appreciate you listening, and I'd like to turn things over to Director Rush for the data report. Thanks.
Good afternoon. Okay, so I'm going to go through our weekly FB brief. This data is through May 1st of 2021. So to date, we've had over 78,000 cases reported within the Cuyahoga County jurisdiction. That is a decrease from the previous week of less than 10%. And we are currently averaging about 120 cases reported per day. So we are continuing to go in the right direction. However, Cuyahoga County continues to have the second highest volume of cases throughout the state of Ohio. So, we want to continue to monitor that, but we're glad that it's moving in the right direction. For fatalities, we've had over 1,500 fatalities reported to date for the Cuyahoga County jurisdiction. 17 new deaths were reported this past week, and that's an increase from what we saw the previous week where we had 9 deaths reported. However, we continue to see that over 90% of our deaths are among those that are 60 years of age and older. For hospitalizations, we have 58 new patients hospitalized this past week. Approximately 60% of our hospitalizations are among those that are 60 and over. So still continue to see most of our hospitalizations in our older population. Next section. So for case demographics, there has not been any change in this over the past several months. We continue to see that the 20 to 29-year-old population continues to be the largest proportion of cases. And so we're, as vaccine rolls out, that number may shift as far as new cases that are being reported. Otherwise, all other demographics have remained stable over the past several months. Next section. Okay, so for our epi curve, as you can see, we have those three main peaks that we've had that's remained consistent. At the very end of the curve, you can see it's maybe harder to see, but there has been that drop that I talked about where we're at 120 cases per day. So we have dropped to where we saw levels back in July of 2020. So again, going in the right direction, and the cases are continuing to decline. The geographic distribution for our cases has also remained pretty stable over the past several months, not 7 months. And there has been no remarkable change here. We are starting to see some uptick in case activity in the western half of the county, but not a significant jump overall. So we'll continue to monitor these trends as well. Next section. And so for our hospital utilization rates, these have remained flat over the past 2 weeks, so not a significant change here. We're still at around 80% utilization for our critical care adult beds, and ventilators remain at about 32%. So that's been pretty flat over the past several weeks. And the COVID patient population in the hospitals has declined significantly as well. We've noticed a decrease in the ED visits over the past 3 to 4 weeks. So over the past 2 weeks, we had an average of about 80 visits per day happening at emergency departments with COVID-related symptoms, but that has dropped down to about 58 cases per day of people reporting to emergency departments for care related to COVID-19 symptoms. Next section. Okay, so this is our testing data. So as you can see, over the past 4 weeks, we have declined in the number of positive test results related to hospitals reporting. And so we're currently at 5% positivity rate, which is really low. Again, it is indicative of the same rates that we're seeing with cases that are also declining. One of the changes that happened with the report this week is the electronic lab reporting. Previously, you recall we had the Center for Medicaid Services for nursing home positivity data. That data has changed through the federal reporting. And so now that information includes nursing homes, hospitals, private labs, as well as the state lab. So as you can see, it's also going in the same direction. We're at about 4.2% positivity rate there. So again, definitely an improvement over what we've been seeing back during the beginning of the year. Next section. And so the vaccination rates, as Commissioner Allen had mentioned, nearly 45% of Cuyahoga County residents, that's over 500,000, has started vaccination, and approximately a third of the population has completed that series. So we really are seeing a good uptake at the start of this, which has slowed over the past 4 weeks, but we continue to push out and have those clinics to try to get as many people vaccinated in the population as possible. Next section. And so this data covers the vaccinations that have been provided solely by the County Board of Health. The demographics here have not shifted significantly from what we've seen over the past month. The age group is pretty much, you can see it's pretty level across all of the age groups between 20 up until those that are 70 years of age. So that's pretty flat. But across the state, we are still seeing that the majority of vaccinations, I think upwards of more than 70%, are still in the older population. So that was due to the phases that we're rolling out. So now we're starting to see some of the younger age groups begin to pick up now that vaccination is more available throughout all populations. So I think that concludes all of the information that is in our report. I know that it is National Nurses Week, so I want to give a huge thank you to all of the nurses here at the County Board of Health and throughout the state and throughout the nation for all of the tireless work that they've done in order to help us move through this pandemic. So thank you.
All right, thank you all very much for your remarks. We now have a few minutes for some questions. If you could just please state your name and media organization when asking a question, and remember to stay muted when not speaking. So with that, we can get any questions. Any questions? All right, then we will keep it short today. Thank you very much. With that, that will conclude this week's media briefing. Thank you very much for joining us, and we will see you in a few weeks. Have a great weekend.
Thanks.